So sit back, relax, and let me show you how to indulge yourself Boca style. Hello, welcome to the Becky and Boca show. Tonight I have one of my favorite Boca Raton doctors, Steve Fagan, MD. He is a plastic surgeon, and you specialize in eyes.
Right.
You did my upper blepharoplasty a few years ago.
Yeah, a while back.
And you do an excellent job in that.
Thank
But
you.
You're also into all the other cosmetic stuff. I know I do Botox and fillers with you.
Yeah,
and-
only injectables other
Yeah.
than eyelid surgery and cosmetic
Okay.
eyelid surgery. I have a fairly large injectable practice.
Yeah,
so,
you do.
yeah.
Mm-hmm.
And I kind of limited my practice to things that I love doing and things that I think I'm pretty good at. So I think maybe that's the problem with some people is that they feel like they need to do everything. And I've realized what makes me happy about going to work every day is doing things I like doing every day. And I think I get better results because I'm very enthusiastic about it.
You're very good with the injectables, and there are a few doctors around town, and I know who they are that are very good, and then the rest are not. And I've always tried to figure out what makes a good injector.
It's a good question.
So can you explain
Well,
what the difference is?
first you have to have, like I said, an interest in it, a passion for it. And then you have to understand what you're doing. You have to understand what you're trying to accomplish with injectable agents because it's not severely limited, but it doesn't do everything.
Yeah.
And, there's some people that feel that they can inject their way out of any cosmetic problem, and you cannot.
Right.
And some of
Okay.
it, frankly, requires surgery. And a lot of it, though, and as the injectable agents get better, you can do more with them.
What about, there's a guy in town that advertises a liquid facelift. Forget
Well,
about having a facelift, just do it.
And a lot of that's marketing, and it
Yeah.
sounds great because we've become a non-surgical world. I mean, if people can get a result without doing surgery, that would be their preference. And I think 20 years from now, our conversation will be completely different. We may not do surgery. Who knows in 50 years? It may be something we've never even thought of,
Right.
like the iPhone. So I think the world's changing. I think the injectable agents have gotten better. I think what happens with the high-level injectors, the ones that are really superb, is they understand what they're trying to do. They see it before, like a good athlete. They see it before it
it's
happens.
almost like an art.
Yeah, and it is. Even with surgery, you have to see the result before it happens.
And you have to know how to achieve the
Right. Yeah.
result.
Well, and then there's a whole palette of options for injectable agents. There's Restylane, Juvederm, Radiesse, Bellatero,
Right.
all these products, and people used to think that they were all the same. And I wrote one of the early chapters in a plastic surgery textbook, actually illuminating the differences. And everybody goes, they're no different. They're all the same.
All the same thing.
And they are completely
They're not.
different. Their performance is different. Where they're most applicable is different. And I think the top-level injectors understand those agents and where to apply them. And then certainly one of the issues is they know how to take care of the problems. I think if you're a top-level injector, they're not the ones that say, oh, you have a problem, you have to go see so-and-so. I think if you develop a problem with a patient, you have to know how to treat it.
Right.
The beauty of some of these injectables, particularly hyaluronic acid, which is the Juvederms
That's the filler
and the
that
Restylane.
people use. Okay.
And they're very popular, Voluma even. And the newer agents is you can get rid of them and dissolve some of them if it's an
Oh, you can. If something
unfavor-
was done wrong?
Yeah. Now,
Okay.
the problem with the eraser, as some people call it, is that it actually is a license for bad injecting. People go, you know what? We'll try this,
Yeah,
and
if
if
it
it
doesn't
doesn't
work,
work,
we'll
we'll
just-
just get rid of it.
And
Which-
I've heard doctors say that.
of course, and I think that's a very poor approach.
Right.
What you should always focus on is how you can get the best result with the injectable, and never really think about how you're
How are you
going
going to
to
fix
get
it if you
rid
mess
of
up?
it.
Is it an injection that dissolves it?
Yes. So
Okay.
so hyaluronic acid, it's a sugar essentially,
Okay.
and basically there's an enzyme that breaks it down. So if you inject it, and they all dissolve differently. Some of the hyaluronic acid products inject immediately, or dissolve immediately after you
Okay.
inject them, and some take a few injections over a period of a couple
get
of
it
days
out.
to get rid of it. But that should never be the mission. It should never be, well, we'll get rid of it if you don't like it. I think your goal is you want to make the patients love it. And
Right.
you need to know the appropriate amount. And the problem is you see it all over town, and we're not the only city that has
Oh,
the
let me
problem.
tell you.
I mean, you see people that
The lips.
and the patients are scared to death. They see somebody and they go, gosh, that's what that product does. It's not the product.
I have seen women around town that look like they have two golf balls. You've
Well,
seen that in their cheeks?
And there's a reason for that.
Okay, what is that?
One of the errors is the concept is a little is good and more is better. And that is so not true for most things. I mean, we saw it with lips 5 to 10 years ago.
Yeah.
Everybody's lips were too big.
There's still a few of those walking around
and
Boca.
of course. So some of them have products that you can't get rid of. And then people realized that they look ridiculous. Finally, their friends would tell them you look ridiculous, or their significant other, or their kids, and they'd stop doing it. Then it moved to the cheeks, as you mentioned. And the cheeks, all of a sudden, from subtle augmentation, which is
enormous.
what it should always, best surgery, best injectable results look like it never happened.
Right.
And the problem is if you can look at someone and see they've had something done, it's usually because it doesn't look good. So the cheeks have become the problem.
Yes.
The next is the temples. Wait till you start seeing people look like Bozo
People
the
are
Clown.
injecting their temples?
Oh, gosh,
Yeah, I
yes.
know. I've heard of this. Why?
Well, certainly very young, athletic women that are usually a very low BMI, very fit, they tend to get some wasting and loss of fat in the temple region.
Okay.
So it gives a very scalloped appearance. Sometimes we call it a peanut head. But they get a very scalloped appearance behind the brow bone and the orbital brim bone, where you can see that excavation.
Right.
Those patients are very good candidates for temporal filling. It actually makes them look quite better, quite young, a bit younger.
Yeah.
So it's not for everyone, and I don't think a slight excavation is necessary. You don't need to treat everyone.
Right.
But that's one of the areas. But back to the cheeks, a lot of the problem is an over volumization, too much product placed in the area, and then there's inappropriate placement of where you put this product.
Big round balls right here.
Well, and it's a technical problem. We talked about it a little before the show. I teach for a lot of the companies, Galderma and Allergan, and we try to teach not only safe but very effective aesthetic injection endpoints. One of the problems with cheeks is augmentation of the cheeks is supposed to be deep, typically down to the bone.
Right on the bone. They lay it right on top of the bone,
Because
right?
what you're trying to do is create cheekbones, essentially. You're not trying to create cheek
I never thought of it that way, but you're right.
Right. So you're really augmenting, you're trying to get structural augmentation to the cheeks. And when you see that cabbage patch look on people.
Not only have I seen it where it looks like tennis balls, but on a celebrity, I saw a strip that was
Of
raised
course.
from there all the way down that looked like, there was like a finger in there.
And if you look at some of the paradigms and injection suggestions of some of the companies, they actually show you that it needs to be injected along what we call the zygoma and all the way to the pretragal area in front of the ear. And so people sometimes will use that as a map on how you inject patients instead of individualizing for what the patient actually needs and what looks best. But again, if you can notice it, it's usually because it's not a great result.
Right.
So
absolutely.
it's usually those cabbage patch looking, it's too superficial. It needs to
Oh,
be
it's
a
not deep
subtle
enough,
amount
okay.
up against bone, so you're actually structurally augmenting it. You're not trying to increase the volume of the
Right.
soft
I guess
tissue.
you wouldn't see it
Up
as
against
round
bone.
right. Because it'd be underneath. Okay.
And the appropriate, you could put enough product in there that you can see it if it's up against bone, but it should never be that much. So when we did the Voluma studies, for instance, which is a wonderful product, again, people want to blame the product. They have a problem, they blame the product. It's
Right.
not the product, it's
Yeah.
the injector. The problem is always proximal to the syringe. And when the Voluma studies, unfortunately, we used 6 to 8 syringes in these patients. Because
In the studies.
the patients weren't paying for it.
Right.
We were trying to get a volumetric
How much would 6 to 8
endpoint.
syringes cost a patient?
Well, the average injector in the U.S., you pay somewhere between $800 and $1,000 per syringe.
Per syringe?
It's unaffordable.
Oh, my God.
It's unaffordable. So in clinical studies,
Right.
which is typical,
Right.
the patients have an unlimited,
Right.
there's no budget. You inject them as much as you think their endpoint is. Usually it's a new agent. So even the physicians, as part of the clinical study, and I've been a part of almost every one, they have very little previous knowledge, because they never used
Because
the
it's brand
product.
new.
So they don't know how to inject it. Even when we did the Botox study, it was phenomenal. We had no idea what we were doing back
Oh, I
then.
bet
This
that
was
was fun.
years ago. and so we saw some unfavorable results and learned very quickly from them in the clinical study. So the FDA study is not only important to get it approved in the U.S. for safety and efficacy, that it works and it doesn't hurt people, but we learn a lot. There's a lot of
Right.
information. We learned a lot for the Voluma study. So we learned that 6 to 8 syringes in most patients is just not okay.
It's
And
way too much?
It's way too much. Most patients can get away with 1 to 2 syringes of Voluma max. And it's just like everything else. It's not how much you put in. It's where you put it
Right.
to get the most result. And that's a fascinating product. There's a lot of new products out on the market, hyaluronic acid, and there will continue to be companies that come up that have a new, innovative way of looking at products and how they manufacture it. But, I think just understanding the product performance, understanding the volumes that it takes to get a good result, takes an average injector to an excellent injector. And that's what we train in our teaching courses. And I love it. People always say, why do you train? You're training your competition. I think when you get great results, patients aren't fearful when they see people walking around town that
Right.
look good. Because
Yeah.
they always blame the product. And it's not the product.
Yeah.
So I think, and then when there's,
I've had people tell me that, women will say they're not going to get lip injections because they don't want lips like that. And I'm like, they don't have to look like that.
Great lips don't look like they've been injected.
Right, right.
And we one of the things we always say at these teaching courses is lips are the easiest area to inject poorly. They're just so easy to mess up someone's...
Why is that?
Well, because, again, usually it's a volume problem, and then it's placement. Where do you want... And everybody's lips are a little different. So are their aesthetic
Yeah, sometimes you
desires.
see the people with the lips that go straight across.
Of course,
with no...
or it's just a duck-like over-volumization of the upper lip.
Yep.
The bottom lip, usually in most people, is slightly larger. So when you're projecting the upper lip much larger, it's unnatural.
Right.
It's not what a lip looks like.
Right.
Enhancing the vermilion border, we stopped doing that for years because we said, we don't need to do that. Enhancing that little border is very important.
Oh,
And it
okay.
also reduces vertical smoker's lines because something that's a fascinating concept that a lot of us teach and we've written about is something called dynamic discord. So
Okay.
dynamic discord is particularly for lip lines. And most people say, I never smoked, and I have all these little lip
Yeah.
lines. Why do I have those? Usually it's the way you speak.
Oh, really?
So if you don't smoke, you have a lot of animation when you speak. Some people speak, they don't move their lips.
Right.
Some people move them a lot. Dynamic discord is an interesting concept where as you get older,
Okay.
your muscles are much more powerful than your soft tissue's ability to resist movement. So typically, like crow's feet or lip lines or cheek lines, when you're 18 years old, your soft tissue is very elastic and it resists the muscle activity in those areas.
Okay.
As the skin and the soft tissue starts to lose its elasticity, your muscles don't weaken as much and they overpower your soft tissue's ability to resist the bending and folding. So
okay.
people typically will start to get lip lines because they lost elasticity and their lip muscles are still strong. So they get real vertical lip lines. So instead of, and the problem we did for many years is, this is a muscular problem. We'll just use Botox everywhere, which is really still the greatest, most consistent cosmetic drug ever discovered.
Botox?
Yes. It still is the most consistent, the number one asked for product of injectables worldwide. But
Is that because young women do it too? And they don't do fillers? Because I know women in their 20s all do Botox, around here anyway.
they do. One of the reasons it is so popular is because it's so predictable.
Yeah.
Unlike fillers where people don't know necessarily certain injectors or patients know what they're going to expect, with Botox, they get rid of a few lines, they get rid of frown lines. It's so predictable. And usually it's the first agent that a young person will use. They don't
Yeah.
need fillers yet.
Right.
They'll try Botox first. So your answer about yes, because younger people use it is probably
And is
part
it
of
true, these young women that use Botox tell me they do it because this will prevent them from ever getting wrinkles in the first place?
Prophylaxis is definitely a real
Yeah.
phenomenon. The question is how young do you really have to start?
Yeah.
Because if you annualize how much that costs,
I know.
if somebody starts when they're 18 years old and they could have started when they're 35 and got the same result,
Right.
that's a lot of money spent. Now, but there is a component of prophylaxis by using it early, but I don't think that should ever be the main goal.
But do they look different, these women in their 20s? If you're saying that they might not really need it, but they're getting it, do they, does their look change? There must be a reason.
Well, Botox done well, like fillers, should not look like the patient had it. So when you do it for prophylaxis, it's much different than trying to get an effect like
Right.
reduction of crow's feet. So typically they don't need the same dose. It's usually much less.
Okay.
And you're doing it to reduce the amount of frowning, to reduce the amount of crow's feet, not completely knock it out. So
Okay.
again, it's a different approach. Same technique in many ways, but I think prophylaxis is much different. And then there's always that debate when do you really start?
Yeah.
So I think you can, in my opinion, start too early. I get patients sometimes that are brought in by their mothers.
Oh.
And you know, and the mother's been very happy with their injectables.
Right,
And you go,
so they think
I
you're
want to
helping,
start
yeah.
her young so
Start
she
her
doesn't
early.
have this. And that's fine.
Yeah.
But I always say they have to be able to sign their own consent. I'm not
Yeah,
gonna, I'm not going to go, Mom, you know, for the minor, why don't you sign? It's not going to happen in my practice. So, and it happens with surgery too.
Oh, wow.
Yeah, it really
No,
does.
what about men and Botox? Do you see that increasing?
Big time.
I would think so.
So
I see nothing wrong with men having Botox.
So you hit on the two largest growing groups that are using injectables, particularly Botox.
Young women and
Millennials
men. Okay.
and men. Mm-hmm. And it used to be men were not interested, but now they are for
Yeah.
a variety of reasons. Prophylaxis, if they're going to do any injections, they want something very simple. It's the male mind.
Right.
You know, I don't want to forget injectables. I don't think I need it. And by the way, it hurts too much. So they're not going to do
Does
it.
it hurt men more than it hurts women?
Everything hurts men more than women. Women are used to injections. They're used to doing things for themselves that might be slightly uncomfortable, and they're fine with it.
Right.
Men typically are not.
Oh, that's funny.
So, but Botox can be relatively painless. So I think men are much more likely to do that. And if you look at the demographics, even the companies that sell neurotoxins like Allergan, who makes Botox, or Galderma, who makes Dysport, the growing market for males is probably
That's taken off, huh?
It's a
I would
sharp
think so.
logarithmic increase over the past 10 years.
Yeah.
But the millennials too, you know, and I think
How about young men? No?
young men too.
Really?
Young men too, and there's entry level drugs like Botox, and even we talked about it on the last show with Kybella. Most young men who've got a double chin and they're really in good shape, they work out every day, they look incredible. They can't get rid of this. They start with an injectable that they perceive there's a need, and that they can tolerate it. So
Okay.
the young men are definitely that group is on the rise big time.
And the Kybella does work, right? It's an
It does.
injection into the fat in the...
So adipocytolysis, which is what it does, it actually destroys the fat cell. It works. The problem with Kybella is really how to prognosticate, meaning when a patient comes in and is sitting in front of you, how many treatments will they need, how many injections will they need, and how much it's going to cost. So the problem is not that as you know, I was involved in the phase 3 FDA trials for Kybella. The drug works. I actually went to the FDA, and the only issues, because providers, doctors, nurses who inject Kybella, they're a little uncomfortable about not being able to counsel their patients with precision. You know, that's why Botox, you give it, you know it's going to work.
Right.
Fillers, you know it's going to work. Kybella, you inject them and they look like they're better, but they need a second injection, and sometimes even a third. And patients want to know. They want to know what they're in for
Before they do.
Right. So and it's completely
And you
understandable.
can't,
But
okay.
it's not unlike laser skin resurfacing. You know, you go get your treatment, and your whoever does your laser say, you know, you're better, but I think you need another treatment. And they weren't prepared for that. You know,
Yeah.
they expected one and done.
So I wanted to ask you, you said there's 2 new Botox products
Yes.
coming on the market.
And Allergan loves when you say Botox products. Because
I know that-
Botox is like Kleenex. And
Yeah, I know.
It's the number one asked for injectable worldwide. And when they talk about in their class of drugs called neuromodulators or neurotoxins, even outside the U.S., Botox is the number one asked for, and it's a brand name like Kleenex.
Right.
So people are used to that.
So they asked for Botox, but there's other
Several
products.
other. Well, there's 2 in the U.S. There's Dysport by Galderma,
Right.
and there's Xeomin by Merz.
Is there any difference, doctor? Because I've had this debate with a lot of women who've tried
I will-
tried the different ones, and they always want to go back to Botox.
Well, the companies will tell you they're the same. I will tell you from a lot of experience in teaching and using it, they are not the same. It doesn't mean one is markedly superior than the other, but just like the fillers, you have to know your product. You can make one work very similarly, maybe not identically, but very similar to the other one. And if you understand the product, you can make it work very well. Now, there are some preferences. A lot of, unfortunately, doctors particularly have a bias towards one company or another, not because of the product, but because of their relationship with the company, which is
Right.
always an issue with me. And I think what you ought to be doing is forget about the politics. Use the best product that you believe in your hands is the best for your patients. But you can make all of these work similarly. One, you may need to push the drug dose a little more.
Is one of them less expensive than the other?
Yes.
Okay.
And but the difference in price is not dramatic. You know,
Okay.
it's not like one is twice
So
as
there's
much.
nothing that's like half the cost
No.
available yet.
Not yet, but you know,
Okay.
you were asking me about the existing ones in the
Right.
U.S. and there are many more worldwide. There's Korean toxins, China toxins, all these countries. There's some of them are made in places that you would never buy this stuff. But
Right.
there's two new products that will probably be FDA approved in 2019. That are very good products. I was involved in the FDA trials for both of them, and they work very similar to Botox.
Okay.
So the companies will again try to prove superiority. That's what they want to either, when you do an FDA study, it's either you're as good, that's what they want, and the FDA is fine if you're as good. They want to say that they're better.
better.
And they'll give you all these reasons and the things that they checked during the trials and they monitor, which maybe was not done when Botox was approved. And they say, well, the onset is in a day, or it seems to last 4 to 6 months rather than 3 to 4 months. And we will find out.
Now that's big.
Well, it is.
Yeah.
If it's true. And we will find out if that is true with time. And the two new drugs are very good drugs. What you'll find, in my opinion, is Botox probably will always be the leader. Like Kleenex, it's been that brand recognition. People get a good result, and they're not
They're
gonna,
happy with it,
they're
yeah.
not necessarily going to switch. And there are those providers, physicians, nurses that will try the new product.
But I would imagine
like-
if one came along at a much lower price that was similar.
If that was true, I think you're right.
Yeah.
My guess is they won't.
Okay.
You know, it's all business, and they look at it as, well, where's the break point where we can make it cheap enough or less expensive, and people will start using our product, yet not look like we're the cheaper product.
the bargain one.
Yeah. So there's that balance that the business guys
Yeah.
figure out, and the
Yeah.
actuaries, but.
What does it cost, just for anyone listening that doesn't do Botox, for the average person to do? Now I'm using Botox as a
That's
as
okay.
a generic term,
And
but
they're all similar.
To do the what do we call them?
Well, the mistake physicians early on that were only using it is they started to charge Botox by the unit. If you've ever heard that.
It's always confusing. Yeah.
Right. So
Don't they still do that?
sometimes I don't
Okay.
charge
What
by
do
the
you
unit.
charge by?
Most of the high level injector, I actually charge for the result, and I give them as much as they need. And my pricing isn't always the same, and it will vary on how much they use. Men typically need more than women. Their muscle mass is greater. They need more drug to get the effect that lasts as long. But I think when you charge by the unit, you're suggesting in many ways that all you have to go see someone who treats with the same number of units and you get the same result.
I know.
And that is absolutely, as you know, not the case.
Right.
And
People
you know,
are always comparing the price of units.
you know, it's like at a restaurant. We use the same ingredients. Okay, but how come the food doesn't taste as
Taste the
good?
same.
So it's really, you have
Yeah.
to go by, and some people will go by, and whoever their injector is, it's the cheapest one they can find because they see no difference.
I know.
And for those patients, that's fine. Those are the kind of, and they're fine with the result. I think the higher level injectors, as we talked about earlier, they're more worried about getting that great result for patients that lasts the longest you can make it last for that individual.
Yeah.
And sometimes you have to push the drug. You know, so when people are charging by the unit, it's suggesting that, well, you know what, with a few less units, it'll be cheaper. But it won't last as long, it won't look as good, and the patients aren't
How
happy.
do you make Botox last longer?
You have to dose people. One of the things that I've learned over a long, as we talked about last time, it was my thesis when I was a fellow. You have to push the drug to maximally perform. So if I gave you, let's use units because I don't really charge by the unit.
Okay.
If I gave you 4 units per each side on the crow's feet and 10 units in the glabella, you'd get a great result that lasted a month.
1 month.
So
okay.
when you push the drug to understand what those muscles need to not make people look weird,
Oh, so that's why sometimes when people get a bargain, they have to go
the bargain
back
never
after
lasts.
a month.
So, and
Yeah.
people always go, you know, I went to this person and it didn't last. And
Yes, I've heard that a lot.
right. So they said, you know, but they were $100 cheaper than you. And, you know, I'm never going to say anything and I never badmouth anybody, but you know what happened. is just they
just didn't use enough.
underdosed because.
So I didn't realize that you get the same result immediately, but it just wouldn't last. I just assumed that it only takes a certain amount to get a result.
Yeah, so that used to be, before we got a lot of experience with Botox, for instance, that it requires a significant amount of dosing. Now, you don't want to use overdose people, not necessarily that they'll get a bad result. More is not better, and you're wasting product that is not going to do anything more than understanding. When you look at people, you have to, it's just like medicine in general. You got to do the physical exam first, and then figure out through your physical examination how you're going to treat that patient. Whether it's for high blood pressure or any other problem, you need to treat cosmetic medicine as an art, but also there's a science to it. There's a methodology to why you would select a certain product, why you would dose it particularly. And I think, again, back to the high-level injectors, they get that. Yeah. They say, you know what, this is what it's going to take to get your Botox to last 6 months. I can get it to last 2 months, but you're not going to be happy because you're going to be back in the office in 2 months feeling it didn't work.
So you can make it last 6 months?
On some people. One of the other things I've learned over a lot of experience is there's a biologic variant.
Oh,
There are some people that, I have patients that Botox lasts a year. It's rare, but they say, you know what, I haven't been here in a year because I didn't need it.
Right.
And yet you get some people, 2 months later, they're going, I'm already starting to see the Botox effect, and I'll even dose them. Some people are rapid metabolizers. They just get rid of the... Same thing with fillers.
I've heard that too.
Yeah, patients with particularly have thyroid issues, they typically are rapid metabolizers. Vigorous athletes, they're rapid metabolizers. So, again, we tend to think we're all the same. We are not.
Right.
And it's, again, back to medicine. It's just like drugs. Why does this high blood pressure drug work for you, but it doesn't work for the other person? We're all different. How we respond to drugs is much different.
So some poor people have to keep pumping their faces much more often than others.
They do, and they're not happy about it.
I bet.
But usually it's the athletic ones that are pretty stoic.
Yeah.
And they don't mind coming back in. If they have to come in every 3 to 4 months for injectables, they're fine.
Okay.
And fortunately, the lethargic ones who are maybe not necessarily real happy about getting injections, they sometimes last 6 months and more.
Wow.
So everybody's different. The other thing...
Okay. All right, we're going to cut to break here.
All right, we'll see you in a bit.
We'll catch you right after the break.
Dr. Candace Colella of Colella Cosmetic Dentistry in Coconut Creek provides family and cosmetic dentistry for patients of all ages and is the only dentist in South Florida offering Solea laser dentistry. No pain, no anesthesia, no shots. With over 23 years of experience, Dr. Colella does fast braces, dental implants, veneers, and more. She can even finish off your smile with Botox, fillers, and lip augmentation. Call 954-428-6923 or visit yoursensationalsmile.com.
You've been listening to and watching The Becky and Boca Show. Ivy Lee's Luxe Makeup and Beauty Lounge in downtown Boca Raton does fabulous professional makeup application. Make an appointment today and see how glamorous you can look. Call 561-409-4065 to book your appointment. Ivy Lee's Luxe Makeup and Beauty Lounge is located at 233 South Federal Highway on the first floor of the Boca Grand Building in Boca Raton. The number again is 561-409-4065. And now, back to the show. Hi there, back with Dr. Steve Fagan, plastic surgeon. And during the break, I showed him a picture of a friend of mine with crepey under eyes.
Yes.
And she wanted to know what you can do about that.
Crepey under eyes, it's a very common problem. The skin of the eyelid is the thinnest skin on the body.
Okay, so that's why that area gets all...
And very animated. So if you watch people smile and speak and talk, grimace, they tend to use their muscles to crinkle the skin a bit. And the thinner the skin gets, the more it breaks. And as we talked about, even with fillers, you lose the elasticity, even that thin skin.
Right.
So what gains the elasticity? Honestly, to date, nothing well. But there are things you can do.
Okay.
A lot of times people will come to me, since my primary specialty is oculoplastic surgery and cosmetic eyelids, is they'll say, can't you just cut it out? Well, cutting out
the skin?
wrinkly skin, just cut it out. And because you're a surgeon, just fix it.
Yeah, just
and
get it out of there.
But think about it. If somebody's got wrinkled pants, making them shorts doesn't take
Doesn't
away
take
the
the
wrinkles
wrinkles
because the existing skin. And they go, well, I don't understand. When I pull it up with my finger, it looks so great. Well, it's
So
an
they
illusion.
just want you to stretch the skin.
Right, and they
Okay.
think that's the solution. So they go, I don't understand why you just can't pull it up. You can, and you can make slack skin tighter. But fine lines and wrinkles are very difficult to fix through surgery, and I recommend laser, skin resurfacing.
CO2 laser?
CO2 is one of them. CO2 fractionated laser is one of them. I don't do lasers. I actually send out to a few people that I really like that are very good at it. I think unless you're doing a lot of lasers, in my opinion, you shouldn't be doing lasers.
No, I
Because
can see where it would be dangerous.
and there's an art to it, just like everything else.
Yeah.
And your occasional laser surgeon is more likely to get into trouble. And that's not an area you want to get into trouble with. And it's not always that you're overtreated and have a problem. It's equally as much a problem with undertreatment. Patients go through a laser treatment and the downtime of laser treatment, and 3 months later they look exactly the same.
It didn't work.
They're not happy. You know, they
Yeah.
paid money for the procedure. They went through the procedure, the recovery, the missing a few days of work or whatever it was, and only to find that it's worse. Now, that's not to say that laser is the answer to everything, and I believe it's not. And there's a very few people, frankly, in the U.S. that are superb, expert, understand lasers like some of us understand injectables. I think a lot of people just use the laser like fillers too much. They think it's an answer to everything. And I remember when the CO2 laser first came out, surgery was going to be over. You're not going to ever need surgery anymore. There's lasers now, and you surgeons are going to be out of business. Well, that never
I
happened.
remember hearing that
You
too.
remember?
Yeah.
It's like this is the new thing, the new wave. And I wrote a few editorials in the plastic surgery journals saying that these companies are trying to scare physicians, surgeons, into marketing their practice and saying, if you don't jump on the bandwagon, you will be left in the dust. Excuse me. And it just didn't happen.
Yeah.
And there is a place for it. I think fine wrinkles, lines around the eye, that's the way to go.
So people would just do that little area
Yes.
with laser? Okay.
A good laser specialist knows how to spot treat and not get coloration changes. And the problem with sometimes when you spot treat certain areas, there's a color change in the transition zone of untreated and treated areas.
Oh,
but
okay.
good laser
That we
people
do.
know how to do that. What usually happens is somebody sees me and they've got baggy lids and crepey, wrinkly skin.
You mean under?
Yes.
Yeah.
So they've got bags, which is really what really can be helped the best with surgery, and some slack tissue and crepey skin. They've got combination
Right.
problem. So what I typically do on those patients is I will do the surgery first and then send them for laser afterwards if they believe they still
Okay.
need it. Sometimes I'll even do it the same day. So I'll have the laser person ready. I do all their
Right there.
eyelid, whatever they're doing, and they're all anesthetized.
So they'll be in the OR with you and do the.
Oh, no, they go to it's an office procedure at that
Oh,
point.
okay.
And they can do that. Now, it's not ideal, and in many ways I wish I did laser, but again, I really believe, as we spoke about, in order to be a great laser specialist, you need to do a lot of it.
Yeah.
Just like anything in life.
Right.
And I am, honest enough with myself and my patients to say, I'm not the best guy for laser. This person, and I know several.
So you have people you can refer
I do.
to.
I have a
Okay.
few, and I like them very much. They're all women. They're
Really?
all- yeah.
Oh, there you go.
They're all-
Okay.
and they're great at it. So I really, well, with a couple of exceptions, but a couple of the ones I use routinely are great lady dermatologists.
Okay, another thing I hear a lot is hollows under the eyes.
Right. Oh.
What can women do or
Glad
men
you-
do
glad you
about
brought
that?
that up.
Because can you inject that with fillers?
You can. I'm a little biased, and I speak at a lot of meetings, U.S., international, and I'm always asked to be the one to talk about surgery versus injectables for, quote, hollows.
Okay.
30 years ago, nobody called lower eyelid hollows.
What do they call it?
They were bags. They said,
Bags.
and when here's the reason.
But it's the opposite of a bag.
Well, it is, except you have to understand where the hollow is coming from. Most patients that have hollows, it's a shadow. The hollow is that
Right.
dark circle that
Yes.
they see that is, in my opinion, closer to sea level than a valley, that's sitting next to a bulge that's fat.
Oh, so people that don't have the bags don't have the hollows?
Not as often. Now, there is that subset of patients that have deep hollows. They had them since their teens. Mm-hmm. And those patients, the young patients, are certainly excellent candidates for fillers. They're not candidates for surgery. And the only thing that works is fillers, and the right filler. And there are so many fillers that people are using now that they're,
So
people
you can
say,
fill that area?
oh, you can, with the right product in the right patient.
Okay.
Most of the patients that I see, in my opinion, that have had injectables around their eyes are not thrilled. Every once in a while,
I've heard it's a tricky thing.
every once in a while you get a patient, usually a young patient with thick skin, because you can hide the filler. Remember, in this area, it's really skin against bone.
Right.
There's not a lot of intervening soft tissue where, like in the nasolabial folds or the lips or the cheeks, you can hide the product beneath a large comforter rather than a very thin sheet, satin sheet. Mm-hmm. And the problem with fillers is most fillers, you can't make it correct the problem by treating that hollow and not have visible product. Or some of the byproducts that these products bring. Most of the hyaluronic acid fillers, the Juvederms, the Restylans, they're hydrophilic. They bring water to the area. So most of these patients, even if you fill the hollow, they get water retention along the rim.
Oh.
So they get swollen-looking eyelids.
Well, nobody wants
so
that.
I will tell you, and this is no exaggeration, I oftentimes will see 3 patients a day in my office that have had injectable fillers around their lower eyelids that just want me to do surgery and get rid of it.
Get it out of there.
They're not happy
Wow.
about it. Now, it's not, and I'm involved in an FDA clinical study now with a very good product that seems to work better than the existing products. As I mentioned, all these products, their profile is much different. Some of the
So
products,
there's a lot of new stuff coming out.
a lot of new stuff, and what you
Okay.
want around the eye is a product that does not have that water retention characteristic.
Mm-hmm.
And if you can reduce that and fill those areas, certainly in the appropriate patient, fillers make a lot of sense. The problem is everybody, their brother and sister, does injectables these days. So when they have a patient, which is a very common complaint,
Yep.
that they have lower lid hollows, they're getting the needle. And unfortunately, most of those patients are not happy. So I think
Why
there's
does it look lumpy? Is that
lumpy, swollen lids, water retention. Again, the problem is you've got a very small space to put that product. It's right up here along the orbital rim where you can feel with your finger. It's skin against bone. There's not a lot of intervening tissue. There's a little muscle, there's a little fat, but not much. So in order to correct the problem, you don't have a big cover that's going to hide your product. So most of the patients, again, it's not an insignificant amount of consults that come to my office that go, I had this stuff injected, I just want it out.
Wow.
And but there are patients that are excellent candidates. It's, again, picking your patient appropriately and using the right product. Mm-hmm. So I think lower lid hollows, as I was getting to, nobody called them hollows 20 years ago. It wasn't even discussed until fillers came along. And now that there's a
we
product
can just fill it
that
in.
works, just fill it. And again, I treat most of the lower lid darkness with surgery. So and it's long lasting.
What are you doing? You're taking out the fat pocket, and that solves the problem?
It does in I would say a majority of patients, yes. And the reason is the darkness, and we can talk about lights and shadows. The darkness is usually a shadow that's created typically from ambient light, which is from above, that hits that bulge, that lower lid puffiness, and then casts a shadow on the area that's flatter beneath it. So
Okay.
if the patients, and I show them, look in the mirror and hold their eye in a certain way that the light now is not causing a shadow beneath the bulge, they go, it's gone. My darkness is gone. And it proves to them that it's a shadow. So many times taking away the bag and tightening the skin, much like everybody does with their finger when they
Yeah.
look in the mirror, they go, I want my lids to look like
So
that.
that's what you would do when you do lower blepharoplasty?
I
You
do.
would tighten
So
the skin and get rid of the bag?
If you look at serial photos of thousands and thousands of patients that I've operated on over 30 years, most of the dark circles are gone. The hollows, what they perceive as hollows,
See, I
are
didn't
gone.
realize that.
Yeah,
I thought
so
they were
it's-
actual hollows.
Well, we create these diagnoses and entities based on the solutions that we have for them.
Right.
And fillers are just so popular because anybody can inject fillers. So
Mm-hmm.
they go, there's so many people that have these, quote, dark circles. We'll just inject them with fillers. But again, be careful. I tell the
Yeah, I
patients,
knew that was a tricky area.
Be careful what you ask for. But there are some, some really good injectors. And again, I'm involved in an FDA trial we're almost through with, injecting a particular product which is very good because, again, as I mentioned, it doesn't bring water to the area.
Yeah.
And it fills
See, I
it
didn't even
without
know that
what we
was
call
a-
hydrophilicity. That hydrophilicity is a problem. Most people, after the age of 40, start to retain water. They start to get the fluid along the lateral zygoma, that cheek area. And once you get that and you put filler in that area, you make that fluid retention worse.
Oh,
So you want to avoid fillers in those areas.
okay. Okay, you say you do an illumination tour?
Illumination
What
tour.
is that?
It's no secret that I do a lot of work with the pharmaceutical companies. And I do it, as I mentioned earlier, really not because it pays me so well that it's great to get out of town. And I do it because I really want to advance the science. I think if you think of things very critically and there's a methodology of the way you do things, make the right diagnosis and the right treatment, we all benefit. When you have, as I mentioned, a bad result, the liposuction, when you have a liposuction complication in town, or God forbid a death from a surgical procedure, everybody demonizes the procedure.
Yeah.
Not that the doctor or whatever. It's always, oh, you can't have that
Yeah,
procedure.
don't get that because somebody...
They were hospitalized because of. So it doesn't even matter. It's a public perception. And when there are problems related to injectables, they always blame the product. So a few of us who are key opinion leaders, U.S. and outside the U.S., we started doing master classes. So we would train pretty high-level injectors to get them to that next level.
Okay.
Allergan knows this, and I've been the chairman of their medical advisory board for many years. They asked me to do a particularly advanced program this summer called Illumination Tour. That's what it's called. So the concept this year is about lights and shadows, certainly relevant to the lower eyelid hollows. Lights and shadows are fascinating because we had a media event in New York City with Sir John. I don't know if you know who Sir John is. Sir John's a makeup artist for Beyonce.
Okay.
Really great, cool guy. I love him. We've become
I was
friends.
going to ask you if makeup artists can just create...
So a lot of
lights.
the concepts of injectable agents and
Come from that.
the reality of what we're doing with them really starts with an understanding of what makeup does. And here we are, a bunch of guys on stage talking to a bunch of beautiful women in the audience who know more about makeup than we do. Fortunately, I have 3 daughters who taught me a lot. But the reality is like with makeup, you're creating lights and shadows. You're conflating highlights and lowlights. And a lot of the changes that we see, even the nasolabial folds, that was the most common area to treat until recently, but it's a shadow.
What do you mean until recently?
Because people are going into other areas of the
Okay.
face. And it's a good point that you make or question. I still think it's very important to treat the nasolabial fold
Yeah.
for so many reasons. And a lot of it is the way you smile. We never think about smile dynamics and how people look when they animate and smile.
Well, that's true because people can get their face injected and then they look creepy when they smile. I
Right.
had a photographer tell me that he'll go to photograph these women that have had a lot of fillers put in their face, and he'll try to get them not to smile because they look distorted.
And that needs to be part of your assessment. You need to figure out which product is going to look completely natural or enhance their look when they smile. One of the things, and I know we're getting a little off track, but with the lights and shadows, is this nasolabial fold is a shadow. And it becomes a shadow because usually light will hit and cast a shadow on the fold.
Okay.
So you improve the light, the reflectivity here when you fill it. The other interesting thing
Right.
is you watch older people as they smile. They look like kids that are saying cheese that were never taught how to say cheese correctly when the parents take the picture. It's kind of like that look, and it just
Yeah.
looks unnatural. One of the reasons is back to the concept of dynamic discord. Your cheek elevators, when you smile, overwhelm your soft tissue's resistance, and that's why you get an over-elevated lip, and you see the upper gum of your upper teeth. And you see the back molars, which you should never see when people smile. It's
Yeah.
why I use that analogy of kids when they say cheese. They
Yeah,
really
really
pull
big.
this muscle, the rasorius, out, and it shows the lateral molars. So when you inject right, it's not only just filling folds and furrows, but you're changing and improving their smile dynamic so they smile more like they did 20 years prior. So you don't
Wow.
necessarily make them look 20 years younger, but their smile is younger.
Yeah.
And that is equally as important. We always take our pictures as surgeons in repose. Patients just
Yeah.
take,
Right.
I take all my pictures now with smiling.
While they're smiling. Okay.
Certainly when I'm treating the area with fillers, certainly not when I'm doing eyes, but it's important. So lights and shadows are ultimately important. Same thing with cheeks. The first thing we talked about is the overinflated cheeks on some of these people we see walking around town. The idea of volumizing and reflating the cheek is to change where the light reflection is on the cheek.
Okay.
We move it from here, which falls with gravity, so the apex and the high point tends to drop gravitationally, back to where it used to be. So all you're doing is slight volumization, and it doesn't take much. It takes very little to change the position of the light reflex, that apex of the reflection of the cheek, which makes people look amazingly better. So I'll give sometimes half a syringe, or we call it a milliliter, half of Voluma
Voluma, okay.
on one side, and they'll go, well, I went to the other doctor, they gave me 3.
Yeah, I didn't get enough.
three didn't do it. What happens is a half in just the right place puts that light reflex right where you want it, and they look better without looking like they've been injected. So it's not how much you put it, it's where you put it.
Can you put it along the jawline?
Absolutely.
Okay.
And it does the same thing. The areas of reflection are typically in between the brows. That's why Botox works so well. We used to think it was getting rid of the lines.
Yeah.
It increases the reflectivity because you don't get the light, dark line, light, dark line. You increase the reflectivity in the area we call the glabella. We used to think we were correcting lines. That's why they look better. It's not. It's, yes, we're correcting lines, but we're making that increased reflectivity. The central forehead is a reflective area. The lateral cheeks, the vermilion border across the lip. The philtral columns, which is the area from the lip to the nose.
Okay.
The jawline, as you mentioned. These are all areas, even the chin, are areas of reflectivity that express youth. And when you pay attention to all those things, to give that light reflection, you can use very little product and make people look so much better. And they can't even understand.
Why?
A lot of times
Yeah.
when I'll inject them, they'll want to look in the mirror right away. They go, I can't believe I look so much better already. And interestingly, Voluma is one of these products. They look better the next day. They look better in 2 weeks. It just tends.
Why is that?
It tends to set. I hate to use that word because it sounds like you're using cement.
Yeah.
But it tends to set in just the right places.
Okay.
The other thing I've learned about Voluma, which is really one of my favorite new products, and I've got no proprietary interest. I own no stock in Allergan.
Okay.
It's a sticky product that acts like glue.
I was going to ask you about that because you say you have to place it right on the bone. I was going to ask, why doesn't it just slide down?
It doesn't. It's sticky.
Okay.
So one of the things I have my patients do is I have them hold.
After you inject it.
I say, hold your face like you want it to be. And they'll always go this.
Yeah.
And there's a sticky component to Voluma that's unlike any other product. It, again, doesn't make it better than any product. It's just got a little, one of the profiles of the product performance is that it has a little stickiness to it that allows things to hold into place. Not only volumize and change the light reflex, but also hold it into that place and not move. So it's one of the reasons I like it for mid-face volume augmentation. I think it's a great product. And that's what we teach at the Illumination Tour, as you were getting at. We talk
So
about
when you put
product
it on the
performance.
bone, it sticks to the bone?
It sticks to the bone, but the soft tissue that rides over the bone sticks to it.
Sticks to it also?
So
Okay.
I joke with one of my partners who we teach with. I call it smash glue. It's actually a sticky. Now,
That's interesting.
there's a lot of other injectable agents, hyaluronic acid agents particularly, and non-hyaluronic acid, that are extremely good and perform in a different way. But this is one of the reasons I like Voluma in the mid-face. I really don't use it much anywhere in the face. Sometimes I'll do it along the jawline. But the mid-face area, the ability to give this look, again, I always tell, what do you want out of the procedures? And people go, I want to look like this.
Yeah, they pull up.
And it's something I believe I can consistently deliver with
Wow.
Voluma. Same thing with surgery. When patients say they want to look like this, they want to go, I hold my finger like that. And the procedures I developed for eyelid surgery, certainly lower lids, really take that in consideration. Patients' desires and delivering what they want.
Right.
And it's important, whether it's surgery or injectable agents. So the Illumination Tour really trains a lot of injectors who are very good injectors how to take it to that next level. And Allergan wants, obviously, to use their product, so we're highlighting their product, but we can show that lifting of the mid-face technique and the changing the light reflection, the apex, and how we treat all those areas to give more reflectivity and not just think about how you put a ton of product in. Because the reality is providers, injectors make more money the more product they use. But
Right.
they're not necessarily making patients happy. So if they've got, several syringes of product and they're not happy, they feel like they've been ripped off.
Right.
They're not happy.
Absolutely.
And there's a misconception about volume. If you think about what a syringe is, people go, a syringe, a product, that's a lot of product. It's 1/15 of a tablespoon is one syringe.
That's all?
People go, that can't be. Do the math. Google it.
So you
1
really don't.
ml, which is typical what
Yeah.
the volumes are, it's 1/15 of a tablespoon. So it shows you it's not the volume that does it.
Right. It's where you put it.
It's where you put it, and it's the performance of these products. I wrote an article, it's been 6 years now, of the biostimulation of using hyaluronic acid. And I even did a study with rats to prove that when you injected hyaluronic acid in certain tissues, and everybody talks about collagen, it stimulated elastin, which is much more important. You want to regain that elastic property of the tissue.
Right.
Everybody talks about collagen because it's the only thing they know.
Yeah.
But collagen, in my opinion, is actually not very important. Nor can you really create collagen that's long-lasting. So people talk about creams.
Yeah. You're
It's
regrowing your collagen.
it's complete nonsense.
We were talking about another thing in the green room. We only have a couple of minutes here, so I wanted to get to it. Microneedling. How do you feel about that? Because everybody's doing that now.
Well, so the microneedling concept is you do small perforations which stimulate collagen.
Yeah.
Anything stimulates collagen. You put it in a needle, you get blood drawn, you'll get collagen stimulation in the area of injection.
Okay.
Microneedling in and of itself is fine. The upregulation of collagen is not very long lasting. What's really cool are new things that are microneedling devices that have reservoirs in them where you can now put active ingredients into the microneedling,
Like what?
which go through hyaluronic acid superficially because it's hydrophilic,
Oh.
gives a glow to the skin. Low doses of botulinum toxin, Botox, that actually reduce a pore size. So there's so many cool things that you can do with microneedling rather than just needling.
I didn't even know that.
Even nutrients. So vitamins people are doing now. I think the next wave of interest, and I think it's the concept, if you can't make the skin look great, everything you do surgically is subservient to that. So you do this great surgical result and their skin looks terrible. The result is average.
Right.
What you want to be able to do is through microneedling and other things and be able to deliver products into the skin
To improve
through
the skin.
to improve
Okay.
skin quality. And if you look at beautiful people,
Are you doing microneedling now too?
yes,
Okay.
and Aqua Gold.
And you have the kind where you put the product in.
Well, and one of them is Aqua Gold Fine Touch. If you Google it, it's a very interesting product.
Okay.
It is a microneedling. It's 24 karat micro channels, which there's a glass reservoir. You can make your little custom made concoction, and then you microneedle into the skin.
Wow.
And whether the problem is we don't completely understand what these agents do, just like PRP. People say it's
Yeah.
so wonderful. Tell me why it works, and I'll be even happier. So I'm still trying to. The patients that I treat with microneedling with substance using Aqua Gold Fine Touch, they love it. The question is can we optimize the solution to make it really long
So
lasting?
what do you think about the plasma
I think it's great.
when they
I
take the
think-
blood out of the arm and spin
Look,
it out?
Stem cells, it's the next wave, and unfortunately, we put this in a big basket and call it stem cells. It's wonderful. Look what we do. I think when we better understand what we're actually doing, we can better treat patients to know what they need. So I think people that are doing it now, it's so much in its infancy. Even though a lot of people are doing it, I'm much more interested in science and knowing exactly where we're going, so we don't make any missteps. And I think the more we understand and learn about it, we'll get better results, figure out better techniques to get those results. So it's microneedling, all these things, they're kind of early, but I think it's the next wave.
Yeah.
Making skin glow, making it look beautiful.
And that can be achieved with
That's-
microneedling.
Microneedling, and again, figuring out which nutrient combination for that individual.
I didn't realize you could put fillers in there with the microneedling.
But real dilute. And
Yeah.
what's really cool is everybody's going to be different. I think what we need is a way to detect what your skin needs versus what my skin needs, and then be able to customize the solution and then do microneedling with that. Again, it's one component of many things that we do to just make people look better, and I think we failed to recognize how important skin quality is because we've never had a great treatment. We use topicals
Yeah.
and skin creams, which are basically moisturizers, which one wants to claim they're so much better than the other. It's utter nonsense. Some are better, sure. Some are not good. But your average good moisturizer is probably, and what works for you doesn't work for me. Everybody's skin requires something a little different. And I just think, again, we just need more knowledge. We need to understand it a little better. And then I think we'll get better at it. And, cosmetics in general, certainly injectable agents, it's early in its infancy.
Really? Okay, so we have a lot to look forward to.
Yeah, surgery's been done for hundreds of years. Injectable agents, maybe 20.
Yeah.
Where we've really used injectable agents. 92 is when, Botox really became popular. So it's not like there's been 50 years of experience, but we're learning. And I think one of the reasons I continue to teach is I collaborate with really thought leaders from everywhere, from every country on the planet, that have a little different bent, twist, understanding from their perspective, and you put all our thoughts together. And some of the advisory boards we've had have been phenomenal, where you just get a few people that are clear minds, thought leaders, and you leave that meeting saying, you know what, we've got a great idea.
Yeah.
We're going to try this. And it's all done to the advancement of science. We don't get paid enough to be on these advisory boards. I'm going to one in Copenhagen. And just because I love doing it, so I'll continue to do it.
Okay, Dr. Steve Fagan. He's right here in Boca Raton, and a lot of interesting stuff today. I learned a lot. I didn't know all this stuff was going on. So.
I learned a lot talking.
Always an interesting guest. Okay, thank you,
Thanks,
Steve,
Becky.
and we'll see you next week.
Take care.
You have been watching and listening to The Becky and Boca Show. Tune in every Thursday night at 6 p.m. to discover all the ways to spoil yourself and have a good time in beautiful Boca Raton. See you next week.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of the station, its staff, management, or sponsors.
1470 AM and 95.3 FM. Download the new WNN app to your phone from your app store.